Chronic tonsillitis, its management. Basically, tonsillitis recurrent and chronic more than 3 months or something is possible, but they are difficult and different way to treat. It is usually non-group B hemolytic streptococcus infection, and the presentation of this chronic tonsillitis is quite different. This child can have halitosis despite having the optimal the oral care, oral hygiene, the toothbrush and others. The child is having bad smell from the mouth, and there is little bit snoring, and the cheesy secretion discharge. Even the speckles of the the serosanguinous sort of discharge might come out from the mouth and the your nasal cavity. And these children has night sleep issues, like night terror is common, and sleep apnea, your obstructive sleep apnea is quite common, and they have chronic dysphagia, they have anorexia, they might have growth failure, plenty of things, and school function maybe poor. There can be, these children can have hyperactivity, and these children can have hypertension, and your excessive sweating, and your sleep disturbance, sleep talking. These children might have anoriasis or bedwetting. So plenty of other issues are involved with that chronic tonsillitis. So thereby it should be dealt in different way. At times it appears to be or it simulates differential diagnosis. Basically, periodic fever, which is aphthous stomatitis and pharyngitis and adenitis, PFA. So it's another entity, inflammatory allergic condition. It simulates like chronic tonsillitis. So these cases, both the PFA and chronic tonsillitis should have surgery. So for the long-term better outcome, and these indications of surgery and the benefits of surgery, it relieves nasal obstruction, it relieves sinus infection, effusion, and it also relieves your difficulties in sleep, hypertension, and other unusual symptoms. If you see the sleep disorders, you can see, you can do a polysomnography apart from the traditional other investigations. So surgery, tonsillectomy, adenodectomy relieves the symptoms of hypertension, sleep disorder, bleeding, snoring, anoriasis, and your excessive sweating, sleepwalking, somnolence, and your school failure, growth failure, plenty of other issues, but they are not common. Be sure that what you are dealing with, you be sure that it is really chronic tonsillitis. So why you will not do surgery when the children actually has tonsillar regression, by 8 years or so. So then the 3 to 10 years, in basically 8 years or something, that the children do have recurrent sort of tonsillitis. Afterwards, you have plenty of fibrosis, and you may not have the inflammation, and this risk-prone behavior of the infection, recurrent tonsillitis, leading to chronic tonsillitis and fibrosis, they are a little bit less common. So considering the whole gamut of issues, keep in mind and do an appropriate measure.